Hi, my name is Silva Hartinian, and we will be discussing the HIPAA case. So the bottom line up front, Hipkins Hospital Department of Orthopedic Surgery is currently seeking to increase their surgeries per day and decrease their patient flow time. To improve Hipkins Hospital surgical throughput and reduce their patient flow time, I recommend hiring two pooled CRNAs and two pooled physician's assistants. I also recommend changing the inter-arrival time to 80 minutes. These changes will allow the surgeries per day to increase to 12.4 from 9. Patient flow time will also decrease by 51 minutes. So the current model on the right side is a snippet of the current model. This was the best simulation that I ran. I ran 5 simulations, and in the bottom left corner is the averages of the full day means. So currently, the bottlenecks of this model are the anesthesiologists and the ORs. As you can see here, they are red. Their utilizations are almost at 100%. Their average utilization is 88.6%. Um, but right behind them are the ORs. The ORs have a very high utilization as well. Um, their average utilization is 69.1%. Um, The average patient flow time is 195.34 minutes. The average number of surgeries per day is 9. This is a job shop process as well. There is high customization and low volumes. Um, each process only has one patient, and each patient has a lot of customization and variance. Utilization. In this model, we are going to be adding two CRNAs and one PA. Um, Currently, the anesthesiologists and ORs are the main bottleneck. Since we're not able to add ORs, we're not going to be able to eliminate this bottleneck. To eliminate the anesthesiologist bottleneck, the utilization needs to be decreased so that they're not overloading. By adding these two CRNAs, their utilization decreases greatly. As we can see down here, when running 5 different simulations, their utilization decreases on average by 17.8%. Due to this change, the surgeons receive patients faster and their utilization increases, causing them to become a bottleneck. Pooling. Um, the model we are going to do is just adding on to the previous model. So we're going to have two CRNAs, one PA, and then we are also going to pool the ORs. Here we can see all 4 ORs pooled. Um, as we can see, the pooling of ORs does not impact the model in a positive way. Pooling works best when the variability is high and resource constraints are moderate, but in this case, the constraints like the anesthesiologist and surgeon workload are very high and severe. So variability is not the primary issue. As we can see down here, all of these stats do not change or get worse. Variance. Here we will be modeling 2 different groups. We have group A, where we combined underweight, normal weight, overweight, and 5% of the obese patients. When we do this, the mean comes out to 97.62 minutes, and the standard deviation comes out to 6.79 minutes. In group B, we will be using 40% obese patients, and the rest will be morbidly obese. The mean of their procedures is 103.8 minutes, and their standard deviation is 13.42 minutes. Basing the patient groups off of BMI does not cause much of a difference, but it does cause the surgeries per day to decrease. The reason for this is due to Group B mainly. Group B standard deviation is very high compared to Group A. And as we can see here, the patient flow time for track A decreases a lot, but the patient time for Group B does not. And then down here we have all of these statistics, and we can see that everything is about the same as before. The model that I am proposing is to hire two CRNAs and two PAs and change the inter-arrival time to 80 minutes. Based on this, the average patient flow time decreases to 147.25 minutes. The OR utilization overall, the average is 71.1 minutes. The number of surgeries per day increases to 12.6. The anesthesiologist utilization is 72.7 overall, and the surgeon utilization is 54.6%. Psychology matters. So humans tend to find waiting times longer when they are uncomfortable or bored. Humans are very uncomfortable when waiting for a loved one to come out of surgery. Since we have already decreased the actual patient flow time, there could be efforts to decrease perceived surgery time. Some strategies that could be used to do this would be status tracking systems. So patients' families could receive digital status updates about the patient's surgical journey. They could also offer comfortable spaces, creating a welcoming waiting area and amenities, such as Wi-Fi and stacks and entertainment, will help them keep their mind off of the patient. They can also offer stress relief measures, such as soft lighting, plants. They can also offer distraction techniques such as entertainment, possibly put TVs in the waiting areas. Um, and they can also overestimate initial wait times. Usually, patients are more satisfied if the actual wait is shorter than the expected wait. In conclusion, the goal, the primary goal for Hipkins Hospital's Department of Orthopedic Surgery was to increase the surgical throughput and reduce the patient flow time. With the changes that we made, the surgeries per day increased from 9 to 12.6. The patient flow time was reduced from 195 minutes to 147.25 minutes. Um, the model that we are proposing, um, so utilization for model, so an analysis of the model. Utilization matters. Anesthesiologists and surgeons are key bottlenecks contributing to delays. Addressing these constraints significantly improves the efficiency. Pooling does not matter in this scenario. Pooling operating rooms has minimal impact on the number of surgeries or patient flow times, making it a low priority solutions for improvement. Variance challenges. Grouping patients based on BMI variability doesn't significantly reduce patient time or increase surgeries. Additionally, it risks perceptions of inequity and potential discrimination. Psychological factors. Waiting for a loved one in surgery is inherently stressful. Strategies to reduce perceived wait times, such as real-time status updates and a calming waiting environment, are essential for improving patient and faculty family experience. Overall, the changes that we are making um, have a positive impact on patients and the employees. and giving them all a better experience.